Hi, my name is Mark Lubinsky. I am a patient of Dr. Gandhi's. He has performed 3 surgeries for me in the past 2 years. Most recently, a neck, a spinal fusion. Prior to that was an SI joint fusion, and prior to that, our first instance was a lumbar fusion extension. I found Dr. Gandhi after doing some pretty deep research. I have a history of 20-something odd surgeries, not all orthopedic, and fortunately, not all related to anything traumatic. So I have a history, a pretty extensive history of lumbar spine surgical intervention. My first lumbar surgery was in 2004. And between then and now, there's been a total of, I think, 6 or 7 surgeries, and Dr. Gandhi would have been the 5th surgeon to be in there trying to help me. And I think what's most significant or important for me is the difference, the level of care that I receive from Dr. Gandhi and the type of person and surgeon he is. So prior to Dr. Gandhi, the surgeons that took care of me were very clinical, very educated, very matter of fact, and on point with here's your problem and we're going to fix your problem, and we did exactly that. Each of those surgeries came with post-op rehabilitation, pain management, and what I remember is probably 6 to 12 weeks of recovery after each of those lumbar fusion surgeries. And the difference between then and now, obviously technology's advanced, and Dr. Gandhi does embrace technology. I do know that from what he explained for the procedures, but also the way that he has honed his skills, his profession. He's very good at it. And what I can say is, after waking up, coming out of surgery from Dr. Gandhi compared to the others, is literally waking up in the recovery room and saying, wow, I feel better. My problem already feels fixed, and it doesn't feel as bad as what I went through in the past. And the post-op recovery time was, so minimal. We're almost talking days versus weeks and weeks to be able to just get up and move around and do what I want to do. I'm kind of active and I don't like to sit still, so that works a little bit against me post-op. But Dr. Gandhi took the time to look at me holistically, where other surgeons looked at, like I said a minute ago, here's your problem and we're going to fix your problem. But Dr. Gandhi looked at everything and said, hey, you've got these years worth of history of progressive disc failure and surgery after surgery. And so he developed a plan to say, hey, here's how we're going to fix you, and we're going to do it once and for all so that this doesn't continue to plague you. And we're going to get you squared away so you don't have to keep coming back to someone like me. So that's how we met, and that's what he did for me to begin with. And then subsequently, the spinal fusions do create extra burden on the SI joints, which I learned the hard way. And he fixed that really quick and simple as well. But then at the end of last year, the end of 2024, I fell from a ladder. And that was my first ever need for surgical intervention because of a trauma. Fractured some ribs, collapsed a lung. Those were not in Dr. Gandhi's job jar, but we didn't know why I fell off a ladder. And so some symptoms with my neck and my arms after that fall led us to an MRI that said, hey, there's something going on in your C-spine. So back to Dr. Gandhi, because I trust him. And he looked at it and said, well, you're on the fast track to paralysis because your spinal cord is getting squished up pretty bad in your neck. And he was able to come up with a very effective plan, very quickly get me on the schedule, get me in the OR. And I don't even think it was 4 days post-op. I was outside probably doing things on his list of not allowed yet, but feeling good enough to be out there and do them. And I mean, it's only been 6 weeks today, and 6, 7 weeks today, and I feel fantastic. But Dr. Gandhi is just fantastic. I know he's highly capable. I know he's highly educated, and I know he cares about patients. We spent a lot of time talking in both the exam room and his office across the hall at the different locations where I've seen him. And he really gets to know you as a person and understand and care for what he can do for you to make your life as whole and complete as possible. And I really think that sets him apart from the other surgeons that I've received treatment from in the past. And so if I ever have the need again for neurosurgical anything, I don't think it matters where we live. I will find my way back to him because I trust him that much and his work is that good.